Thank you, May, for giving that good lecture. It will lessen my time to speak. So I'm gonna be talking about managing kids and teens with ADHD during the COVID-19 pandemic. No? Okay. So I'm not connected with any pharmaceutical companies at this time. So our objectives for today is to give a brief overview of the changes happening in children during the COVID-19 pandemic. I will be fast in this section because a lot of them were tackled by Dr. May a while ago. We'll address the challenges in the home for families who have children with ADHD, address the challenges in the child with ADHD, and address the challenges in the schools and centers. I'll also give you guidelines in the medical management of ADHD during this COVID-19 pandemic. Okay, so the appearance of the COVID-19 virus in the early part of 2020 has changed the world as we know it, no? And this is the recent statistics, no, as of yesterday from the World Health Organization. So the confirmed cases are almost 40 million, like a third of the Philippine population, and more than 1 million deaths already, no? Okay, in Southeast Asia, there's more than 8 million confirmed cases. Now, in the Philippines, there are already 359 cases, and in Quezon City has the highest amount of confirmed cases of COVID-19, no? So here in the Ilocos region and in the CAR, almost the same, no? More than 2,000 in both our provinces, no? So let's go back to the global picture of the COVID-19 pandemic. 2.2 billion, there are 2.2 billion children in the world, and 28%, that's 28% of the world's population. And 16% of these children are 10 to 19 years of age. Okay, this pandemic may have increased long-term consequences to children and adolescents compared to adults. It was mentioned earlier by Dr. May that 3 to 6-year-old manifest symptoms of clinginess and fear of family members being infected. And 6 to 18-year-old children may manifest as inattention and persistently inquiring about COVID-19. And young children felt uncertain, fearful, isolated, experience disturbed sleep, and may have nightmares, no? Also, they may have separation-related anxiety, especially if family members were quarantined and were not with them for 14 days or more. For school-age children and adolescents, there's uncertainty and anxiety. And this was attributed to disruption of their education, disruption of their physical activities, and lack of opportunities for socialization. And for older adolescents, they're anxious regarding the following, no? Cancellation of exams, exchange programs were canceled, and even academic events. So in my son's school, they have immersion programs and it was canceled, or even moving up ceremonies that they were expecting, it was canceled. So, and there were studies show that there's rise in hoarding behaviors among teenagers. So I wonder if we have that here in the Philippines, no? There's also increased use of internet and social media. Teens use them compulsively, no? The internet compulsively. There's access to objectionable content and increase their vulnerability to being bullied or abused. So 1 in 6 children, 2 to 8 years old have neurodevelopmental or behavioral or emotional difficulty, and 11% of the children aged 4 to 17 have inattention problems. And children with special needs encounter challenges during the pandemic, no? Intolerance for uncertainty, loss of regular routine, difficulty following instructions, and difficulty understanding the pandemic situation. So with the closure of schools, especially special schools and daycare centers, they lack access to resource materials, lack of peer group interaction, and opportunities of learning important and social behavioral skills. So this leads to regression. I've had several patients who regressed in their Skills, because they did not have therapy for a long time. There are outbursts of temper tantrums and conflict between adolescent and parents. For children with ADHD, they struggle to make meaning on what is going on, and it's difficult for them not to touch things. There are chances for hyperactivity increase, as mentioned by Dr. May earlier, heightened impulses, and difficult for caregivers to engage them in meaningful activities. So there was a study in Israel, as mentioned by Dr. May earlier, but the study also showed that there's higher risk for COVID-19 infection for those individuals with ADHD that are untreated with medications. No risk was noted for COVID-19 individuals with ADHD who are treated pharmacologically. Okay. So when we implement strategies, we have to consider the following, no? The level of understanding of the child, the family of environment, the physical environment of the family, and online and offline support. Okay, so we will look into the following when we manage children with ADHD. Of course, the center for this is the child or teen with ADHD. We have to look into the school setting, home environment, behavioral intervention, and medical management. Okay, so schools were closed due to COVID-19, no? At the start of this school year. And we shifted our educational system from face-to-face to online education. So there's a lot of changes that went on, no? Since March, okay? So we shifted from distance learning activities where it is real-time or synchronous, where learning experience, students have some type of social interaction with the teachers, and asynchronous. That means it's not real-time learning experience where students interact with online resources at their own pace. So with online learning, I will focus my talk on online learning. No? It requires students to be self-guided. They should manage their time and motivation, complete tasks, requirements, and assignments on time. It is also a way for them to develop independence. No? So schools during this time should have had orientation to parents and students to set expectations, rules, and regulations, and inform them on how they will be assessed. So hopefully your schools have done this before the start of the school year. No? They should also be consistent in implementing rules and regulations and be open to feedback and suggestions. No? The teacher should be available when students have questions, and they should schedule short breaks, no? In between classes. And the guidance should also be available online. No? There should be enhancement of non-academic support. Okay, those children who have individualized education plan, the school should support it and should continue it because it is designed to support an individual's learning needs. So this must include instructional interventions, accommodations, and modifications. Okay. For the teen with ADHD, there are 3 core symptoms. Again, hyperactivity, impulsivity, and inattention. So I listened to the ADHD Society's webinar last Sunday, and it was interesting that Dr. Allen shared what happened, no, in her school when they did survey on the parents after the first quarter. And so even with online learning, they also exhibited, no, the symptoms of ADHD. So they would often stand up or move around while online classes are going on. So in their school, they allow the children to have their the drink or some snack while having online classes. They unmute themselves and blurt out even when not called during online classes, no? And they use the chat box for things not related to the lesson. So Dr. Allen shared, no, during when there were numbers written on the chat, she asked the student, what are those numbers for? And it's not related to the lesson, it's about something about gaming, no? And when they asked their students to open their camera, some will not be attentive to the teacher. They will see they are smiling. And lo and behold, the parents would say they're watching something else, no, while the class is going on. So They also show difficulty following directions. They get upset when encountering difficulties. They cannot sustain their attention. They easily get tired, and grooming is also affected. No, sometimes they will see the children when the camera is on with their feet up on the table, wearing their pajamas. No, okay. So when you observe your child doing this, you have to discuss with your child the proper behavior while they're having their online class. You could have positive reminders near their computer instead of saying, "Don't put your your leg on top of the table." You can say, "Put your leg, on the floor," as a reminder instead of "do not, do not." You should write like positive reminders near their computer. No, chat only about relevant things. No, in the chat box. No, that's what you can tell your teenager or your child. Okay. So draw a demarcation between house chores and school setting. There was a teen who told me before that sometimes while they're having online class, the mom will give them uutusan ba sila ng mom, or kaya papaalaga yung batang kapatid while the mom is cooking. So there should be demarcation between house chores and school setting. So I told the teen, why don't you place like a sign, discuss with your parents na when there's online class in session, they should not disturb you. No, you can have a sign placed near your computer while you're having the class, and discuss this with your parents. Okay. Kids and teens should advocate for themselves. You ask the teachers for instructions and clarifications if you don't understand the lesson. And the school, as I've said earlier, should be also open for them, for the child to ask them and promptly answer their questions. Sometimes kasi the students will say, late ako sagutin ng teacher, no, when they ask their questions online or they email their teachers. Okay? And be aware of changing behaviors. If you see signs of anxiety and depression, like there's change in sleeping pattern, increased repetitive behavior, excessive worry or anxiety, and decrease in self-care, seek help from a mental health provider, or medical provider. Okay? So don't hesitate to ask for help. The National Center for Mental Health has a hotline, I dialed 1553, but if you're on the phone, cell phone, you have to write 02 before that. And they answered naman. I called them and they answered after 3 rings. So mabilis din naman silang sumagot. So ask for help if you think your child needs help, okay, or you need help per se. So the coronavirus pandemic also let us be quarantined in our homes. Most of the activities are in our homes right now, no? Okay. So what can parents do, no? Since young children are anxious because they don't know what's going on, for young children, you describe the virus and current situation in concrete language and terms. For example, you tell them the coronavirus is a type of germ, very tiny, you cannot see them, and when they get inside your body, it can make you sick. So that's why we have to do hand washing, put face mask, put face shield, no? And do social distancing, okay? And parents can build new routines. I'm sure some of you have routines already after several months of the pandemic, no? So, but it will be a lot of demands for the caregivers because aside from homeschooling their children, they also continue to work in and out of the at home, no? Especially those who that go outside their homes, no? And caring for multiple children or family members. So there's a lot of demands for the caregiver, no? Okay. You should include play, leisure activities, and exercise in your routine. So, dapat nakaschedule yan. Okay. It will be challenging for families with a lot of children, no? Especially if there are 2 or more, no? Mahirap nun. But if you are committed, I'm sure you will find a way. You can ask your therapist, no? Your teachers or your friends on how they did it. Okay. And you have to coordinate with the school if you're a parent, no? Ask for the schedule, what is expected during class, what are the rules and regulations, what are the needed materials for projects, and if there are online orientations and meetings, you should be there, no? So that you know what's going on and what's expected of you at home. Have a designated place for a workspace at home, no? Free from noise and distractions. This is nice because you're facing the wall and all your school materials should be there within reach of the child. Sometimes kasi in class, especially if the children are muted, the teachers will hear, Mami, paabot ng pencil, Mami, paabot ng eraser, no? Oo. So, cannot focus on the class if they don't have their materials with them. So have it available within reach of the child when they're having class. Okay? And place a visual schedule near your child's workspace to help him focus. Then they can check off the tasks that are completed. And when finished, praise them for their effort. So providing rewards for certain amounts of work done will be very helpful. Now, doesn't necessarily have to be expensive, no? Can be enjoyable activities, no? Positive feedback, putting star or sticker, or a simple hug will do, okay? And you should take a break. Not only the child, but also yourself. No? You need to take a break. If something is too challenging or you see that a child hits a certain frustration level, it's okay to take a break, okay? It's okay to slow down the pace to give your child time to process the information. And take a break too, no? Also foster connections, no? Positive social support is important not only for children with ADHD, but for every one of us during this period, no? Can be through text or direct messaging, okay? Or through Google Meet or Zoom, no? Or WhatsApp. Attend religious services online and play games, no? In my son's school, we have chill out activities, no? With the different batches where they share and play games and they share their experiences having this online class, okay? It is difficult for parents to handle them on their own. So since they lack professional expertise and they mostly relied on schools and therapists to help them out. So the support system should be very strong there. And intervention shifted online, no? The interventions like therapies, no? Occupational therapy, behavioral therapy, speech therapy, and SPED interventions have shifted online. Okay, some of them do face-to-face already, no? Some of the therapy centers, but they have all their complete gear. Others have shifted to going to the houses of their clients. But there was a shift now online having teletherapy. Okay, there was a study in University of Washington that supports the feasibility of teletherapy for children with ADHD, no? Especially behavioral intervention. However, in this study, it does not improve caregivers' distress because all of the effort is through the caregiver. So pediatricians or doctors who handle families who have children with ADHD should also ask how the caregivers are doing, no, at this time, because they are more distressed because they have a lot of work to do in handling these children, no? Now, the coronavirus pandemic also have changed how we see patients in our clinic. So the first few months, we did not have clinic at all, no? But now there are some clinics who do face-to-face. In my clinic here in Pangasinan, I already do face-to-face since May, but it's complete with PPE, face mask, and face shield. And I had myself checked after 2 months, negative naman. But I space out my patients, no, in between and only do it in the morning. In the afternoon, I do online consults. But most doctors now do online consults. Okay. Now, as I mentioned earlier, those children with ADHD that are untreated with medication have a high risk for COVID-19 infections. So if the clinician thinks there's a need for the child to be medicated, what do we do? Okay, how do we deliver this care to our patients? No, the European ADHD guideline group had recommendations on how to start ADHD medications during the COVID-19 pandemic. Okay, so they have set 3 criteria. First, the person with ADHD should not have a personal history of shortness of breath on exertion compared with peers, fainting, excessive palpitations, breathlessness or syncope, um, and any previously documented hypertension, congenital heart abnormality, or cardiac surgery. No? The second criteria is individuals with ADHD does not have a family history of early, less than 40 years old, in the family, having sudden death in a first degree relative, suggesting cardiac disease. And the patient must have baseline monitoring before initiation of treatment, like BP and heart rate, that can be measured by family members or another person remotely on 3 separate occasions. Okay. If the first or second condition are not satisfied, refer to our cardiologist before starting pharmacologic treatment. No? Usually, stimulants and atomoxetine was mentioned in this study. If only the third condition is not satisfied, the healthcare provider needs to evaluate the risk and benefits of face-to-face evaluation in the context of the severity of the ADHD symptoms and the impact on the patient and the family. Okay? So, in summary, I gave you a brief overview of the changes happening in children during the COVID-19 pandemic, address the challenges in the home for families who have children with ADHD, address the challenges in the child with ADHD, address the challenges in the school and centers, and guidelines in the medical management of ADHD during the pandemic. So the COVID-19 pandemic has challenged humanity to rethink the way we live and the way we do things. So it has changed a lot, in our community. Okay, change is hardest at the beginning, messiest in the middle, and best at the end. We learn in the process. Out of difficulties grow miracles. Okay, and taking care of yourself, most especially during this time, is part of taking care of your kids. Okay, thank you.